Morning. Thank you for joining Census Data Made Easy, Health and Health-Related Statistics. Today we're going to take a look at health and related data offered by the U.S. Census Bureau, all available online and free of charge. And I'm going to spend a few minutes introducing the data in a presentation and then move into the online demo. The map on the screen shows the data of the percent uninsured by county in 2017, released last month by the Census Bureau from the Small Area Health Insurance Estimates Program. The headline on the news release stated over one-third of counties had an uninsured rate below 10%, meaning that 38% of all counties, 90% of the population was insured. You can see this in the counties colored light yellow on the map, and the highest concentration of these counties in the Midwest and the Northeast as well as the West. Those counties in the darkest blue fell into the highest uninsured category, offered by the map, 25% or more uninsured population. So what stands out here are high uninsured percentages in counties in Texas, and we see high percentages of uninsured in counties in Oklahoma, Florida, Georgia, Mississippi, and peppered throughout South Dakota, Wyoming, and Idaho. Health is a multifaceted topic that we can view from many sides. Today we'll look at health from several angles, including health insurance, disability, income, and health-related topics related to behavior, including prescription drug use and complementary therapies such as chiropractic care and yoga. Additional health insurance data from the Small Area Health Insurance Estimates Program is offered in an interactive tool. We're going to take a look at that tool today during our online demonstration. This trend chart shows data on the percentage of the uninsured population for the nation, the state of North Carolina, and selected counties within North Carolina, with Graham County and the 2010 data point highlighted, which shows that in 2010, 24.9% of the population in Graham County was uninsured. The data on the screen only goes to 2015, but today we'll look at the most current data in the system, which is 2017. And we'll explore this tool more during the demonstration. We're also going to look at data on disability status and disability type from the Census Bureau's largest survey, the American Community Survey, which collects data from over 3.5 million households annually and produces statistics on a variety of topics, including income, veterans, grandparents, caring for grandchildren, employment, housing, and more. And here on the infographic, we see that men 65 and over and 75 and over are much more likely to have a hearing difficulty, while women 75 and older are much more likely to have an ambulatory or independent difficulty. We'll explore some disability data within the American Fact Finder during the online demo. I've also included a link to more information about the American Community Survey at the end of the presentation on a resource slide. And also the link to this infographic, which is at the bottom of this slide, will take you to our data visualizations page, and just click on infographics and visualizations to view them all cataloged by year. We're also going to go into the Census Business Builder, which of course has data on business, as the name suggests, including those in the healthcare area, but it also has basic demographic data, characteristics of the population, and even consumer expenditures, including how much people are spending on healthcare and other expenses in a given year. Lastly, we'll touch on some of the data collected by the National Health Interview Survey, which is a survey the Census Bureau conducts on behalf of the National Center for Health Statistics. The bar chart shows that 48 45.8% of the population had used one or more prescription drugs in the last 30 days as of the date they were surveyed, which was sometime during the 2015 to 2016 period. So in 2015 to 2016, 45.8% of the population used one or more prescription drugs in the last 30 days. Prescription drug use increased with age overall and among males and females. So some significant differences in the findings were that prescription drug use was lower among males than females, although the pattern differed by age. Among children aged 0 to 11 years in dark gray, prescription drug use was higher among boys at 22% than girls at 13.7%, while among adults aged 20 to 59 in dark green, prescription drug use was lower among men than women. No significant differences by sex were observed among adolescents aged 12 to 19 or adults aged 60 and over. The Census Bureau really is your key data resource for areas large and small. In the first few slides, I've already shown some examples of data at the national, state, county, and zip code levels. The scope of census data is so broad, the information I'm sharing with you today is just a small piece of the total package. Data on such a variety of topics available at the national, state, and local level can be extremely useful in your research and really broaden the scope of what Census Bureau data can help you accomplish. I'm going to go ahead and go online now. We're going to talk about Census Academy after we get done with the online demonstration. Okay, so we want to go to www.census.gov. Go ahead and make this a full screen here. Okay, now we're at the Census Bureau's homepage. A very quick tour of the Census Bureau's main page. I want to cover just a couple of things here. You'll see below where we have the most recently released information, which is again from our Population Estimates program. We have help for survey participants. So if you find that your address does fall in sample, you have some questions, you can go to this link and find a bunch of resources for survey participants. You can access local data here right in the middle of the screen by clicking on this and going into Quick Facts. And we have economic indicators over here on the left with the most recently released economic indicator up top. There are additional economic indicators you're not seeing here, including new construction, new housing starts, as well as home ownership rate. All right, so we're going to first go into the Small Area Health Insurance Estimates tool. How do we get there? Hover over Explore Data, then go to Data Tools and Apps. And the Data Tools and Apps link will provide a list of all of the tools and apps we have on the website. And because this one is called the Small Area Health Insurance Estimate Tool, it is on the last page. Next, it's right here on page 2, the Health Insurance Interactive Data Tool. All right, we're going to click on it and it will take us into the tool. Okay, so What kind of data is offered here? Well, you can choose to view data on the uninsured or the insured population by state and counties, as well as some characteristics including age group, race, sex, and income, less than or equal to specific income to poverty ratios specifically. All data for the 65 and under population is in this tool. So since the 65 and over are most likely insured through a national program. So all the findings here come from the Small Area Health Insurance Estimates Program, which is the only source for single-year estimates of the number of people with and without health insurance coverage for each of the state's 3,141 counties. Small Area Health Insurance Estimates, or SAHE, produces and disseminates model-based estimates of health insurance coverage for counties and states. All right. So you've got 4 different views within the tool. The first is the default, this home view, where we have the map, trend chart, and data table. So you can expand them all to make them larger. We're going to do that momentarily. All right, so for this example, let's say we're interested in finding the percentage of those without health insurance coverage in all counties in South Carolina from 2007 to 2017. So I'm first going to expand the map view. And as our map renders, I'm going to go over here to states. I'm going to click on the filter. I'm going to sort Z to A. South Carolina. And click OK. And the map renders. The map legend is over here to the left, and we can open it to get a better idea of what these colors represent in terms of percentages. And if we look up top here, it says percent insured or uninsured, and we have uninsured selected. So that is what the map is showing us. It's the percent uninsured by county in South Carolina. And we see some high rates here. Saluda County, 18.6%. Horry County, South Carolina, 17.4%. And Jasper County, South Carolina at 20.4%. So let's see how health insurance coverage differs by age group. We can open up our age group filter, and now it is just the universe of under 65, so all people under 65. And there's a trend that the highest rates are in the 18 to 64 age group. And let's go ahead and select that. So we have the highest rate here in Jasper County, South Carolina, which is just north of the Georgia border, because we've got Chatham County here, South Carolina. And this is the Savannah, South Carolina area. And we've also got options here if we want to add streets to our base map. And that will also show us some of the larger cities, such as Savannah here. We can change transparency, make it more or less transparent. So let's reposition the map again to get a slightly better view of the Savannah area. And if we want to look at data for these counties specifically, we can click on one, which here, such as Jasper. And then hold the control button down. And we can click on the other two counties that surround this county. These counties are part of the Savannah metro area. And you see that these counties are now outlined in red. All right. If we want to, we can explore some of the other filters, such as race, male and female, also income, currently the only selection that's available to us is all races, just because of our Zoom level. We're at the county level currently, so we don't have a selection there. You can take a look at sex. If we wanted male only, we would click on that and click OK. And so it's a good idea to go ahead and take a quick look at that legend here, and we can quickly see that 42.1% is the highest. So how our counties fare, it's about close to 30% in Jasper County. Let's see what it's like for females. Right, 21.3%. We have a margin of error here because, again, these are not numbers from a decennial census. They are, these specifically are model-based estimates, which we use different data sources from the Census Bureau to come up with a model estimate, and a margin of error is always provided here. So we've got a good bit lower for women, the uninsured rate for women in Jasper County, South Carolina. Okay, if we want to look at income, I'm going to go ahead and go back to both sexes to get a larger universe here and get some more data. I'm going to open up income. Okay, all incomes or less than 200% of poverty here. Let's go ahead and select this one. The less than 200% of poverty, which represents 2 times the poverty threshold for a household. So if the poverty threshold is, say, $24,000, 200% of poverty represents $48,000 a year. So this will show data, if we select this one, for people with incomes of 2 times the population threshold or the poverty threshold. Click OK. Okay, and so we see much higher rates of uninsurance for the population with less than or equal to 200% of the poverty threshold. If we wanted to do 37%, 34.5% in this whole metro area, quite high, 35%. If we want to view data for other years, we can select the year drop-down up top and view the data for other years. We'll say 2012. The numbers are different from 2012 to 2017, higher in these two. Okay, I'm going to shrink the map now and go ahead and take a look at this trend line to the right. So I'm going to expand the trend line, click on the arrows. Okay, so we can see that the purple, which is Beaufort County, South Carolina, is the highest. Pretty much all the way through from 2006 to 2017. And we get a comparison. We get South Carolina, and we also get the United States. So it's nice to have a comparison point for these numbers. We can get a feel for how they've changed. We see that Jasper County is higher than Beaufort County starting in 2016. All right, I'm going to close this, minimize it, and now let's go ahead and look at the data table. So I'm going to expand the data table. Okay, and you can see that we have all of the information here. This is the number, you get the margin of error for the demographic groups, just the population numbers and the number of uninsured. You've got options here, so you can download it as a PDF, CSV, zip file. If you have questions at any point, you can always click on the question mark, and it provides quite a bit of information on whatever view you're looking at. So here it's the table view. Information on sorting. So we'll close that, and we see 2017 and 2012 because those were the years that we had selected. Just want to go back. We'll get the entire view here. If I go to the year filter, we can actually check all and get data for all years. You could download that if you wanted that for all of the geographic areas that we saw in the trend chart. Okay, so that is the health insurance estimates tool in a nutshell. Now, I want to go into the American Fact Finder. There's a couple different ways I can do this. I could just go back to the home page. I could hover again over Data, Data Tools and Apps. And because the American Fact Finder houses all of the main sources, the largest sources of census data, it's right here up top. So you can click on American Fact Finder. You can also type in factfinder.census.gov in your web browser. And the Census Bureau is in the process of transitioning to a new platform, data.census.gov, and the data we'll look at today is from the American Community Survey. Future releases of the survey data, which will occur later this year, will be in the new system. So be on the lookout for training opportunities on this new system in coming months. The American Fact Finder will stay active for a while after the new platform is fully operational and will be stored in an archive for the data currently present. So what you're learning today will carry over to the new system in terms of content. The data, the content will not change. So we can use the American Fact Finder to access disability status and disability type, that data. The way I use this system, I go directly to advanced search. I would like to point out this glossary over here. If we wanted to learn how the Census Bureau defines disability, click on D. Click on disability. And it will give you information. You can also click on related topics if you want more information. Okay, so I'm just going to use the search box here, topic or table name, and I'm going to type in disability, because that's what we're looking for. I'm not going to take any of the suggestions. I'm just going to type in disability and click go. And you'll see in our selections box, we have people, disability here, and suggested tables, or tables that are the most popular, are here with a yellow star next to them. So we've got disability characteristics, sex by age by disability status, selected social characteristics, employment status by disability type. Then go ahead and select the top table here to view some of the characteristics of disability. And this is the subject table, and I know that because the table number starts with an S. And subject tables feature a variety of data on a given topic, and they have both numbers and percentages, which can be very handy. And again, they always have the letter S to begin their table number. I'm going to go ahead and make this larger so you can see it better. There you go. So as you see, we've got the total, the number, total population, total civilian non-institutionalized population. So take a look at that. And then we've got the number with a disability, and then it gives us the percentage for the disability. We've got margins of error here as well. We can make modifications to our table. We can click on Modify Table. If we wanted to just view the estimates, and not the margins of error. Just click on estimate and click on OK. Makes the table a little easier to view. And then we can take a look at how the percentages differ by race and Hispanic origin. We've got a higher number here, the American Indian, Alaska Native population. Scroll down and see how it differs by age. And then we also have detailed type by detailed age. So detailed type of disability by detailed age group. So the age groups are population under 18, under 5, and 5 to 17. In that first group, then you have 18 to 64, also 18 to 34, 35 to 64, and so on. So for example, if we wanted to know the percent with a cognitive difficulty in the population under 18 years, it's about 4%. Okay, and that continues on. If we want to do something with our table, if we want to download it, you can click on download above the table. Okay, you can select to use the data if you want it in a CSV file, or your plan is to upload it into some kind of software like GIS or statistical software, or you can view the data and receive it in Excel or PDF. We can add or remove geographic areas right here from the table. So we wanted to add in, say, Washington State. Washington, click go. We want Washington State. You can also include California. You need to spell it right. Okay, and click on Show Table. And the table will pop up with data for the geographic areas that we selected here. California and Washington. Take a look, we see a higher percentage with a disability in Washington. And then you can just go down and compare the numbers here. If you have multiple geographic areas and you want to create a map, the Create a Map button will allow you to, actually what I need to do is reset our table first. Sometimes it makes you reset your table before you can create a map. So now that we have two of the same geographic areas, two states, we could create a map. Okay, and we could say, I want a map percent with a disability for these two states. And we do so. We could certainly add in other states, add in other states to make it more interesting. But that's just the basic function of creating a map. All right, go back to advanced search here. And you'll see we have quite a few tables. We've got 1,720 tables here in our selections. There are more filters you can select over here on the left. But in the interest of time, we are going to move on to another tool. Let me go back to the main page. All right, so now we want to look at Census Business Builder. We're going to explore data, data tools and apps. This will come up. We're going to Census Business Builder, which is right here. And this is the landing page. The Census Business Builder is not only useful for those who are looking to start a business, but it's useful for anyone who's interested in examining a population in a given area. It has a very easy-to-use mapping interface and data on a variety of topics, including the population 65 and over, and consumer expenditures on healthcare. Right, so let's say, we'll start our example in just a minute, but let me make sure These instructional flyers are excellent. There's instructional flyers on all the different topics. So if you have any questions on any aspect of Census Business Builder, it is probably covered in this one of the instructional flyers. It's amazing. Some webinars, helping frequently asked questions. And just remember that is there as a resource for you as you begin to learn the tool. So we're going to go ahead and just select the Small Business Edition. Okay, so while it's rendering, we work for a small nonprofit organization in downtown Memphis, Tennessee, that assists low-income seniors in the immediate area. Volunteers work with seniors to make sure they're getting what they need, such as giving them a ride to doctor's visits, to get their flu vaccine, picking up groceries, helping the tool locate doctors or pharmacies. And we're looking to expand our services to seniors outside the downtown Memphis area. We want to use resources wisely, and we want to start by finding one or two areas with concentrations of seniors who may need our assistance. So we said Memphis, Tennessee. I'm going to go ahead and type in Memphis City, Tennessee. And it does want us to select a business as well. So this is the second piece of information we have to put into Census Business Builder. So we want to research healthcare and home health care here. I want to go to our map now. Okay, and there was an error that said error fetching data. You can ignore that. It is fetching data. It's an error, so there's an error message. Okay, so what we see here is in Memphis, Tennessee, up top, we've got a few different options. We have city or town, zip code, county, state. The ones that are grayed out are not available, but right now we're looking at city or town. We're looking at Memphis, and we work in the downtown area. And what we see about Memphis, we don't see the home health care data unless we select it specifically, but we see the population. This is our data dashboard over time. We see an increase in population over time. And Census Business Builder provides you with 4 data points: median household income, percent high school degree or higher, home ownership rate, and employer establishment. And we can make changes to that if we want. And over here is our legend. And so we know that those, the total population, which is the default view when you enter into Census Business Builder, the total population categories are here. And those in blue have the highest population. In our example, we said we work in the downtown Memphis area. So I'm going to change this to zip code to get a little bit more granular in terms of geographic area. In order to see data here, we would click on a zip code, open up our data dashboard, and it will provide data for that particular zip code. As you see here, 38105. We've got median household income, 18,000. High school degree or higher, 79.7%. I'm going to zoom in just a little bit. And because our business assists seniors, one thing we want to know is where people 65 and over live, where high concentrations of those people live. So we want to change our map variable. How do we do that? Well, we go up here where it says select map variable. Again, total population is the default. Let's scroll down. There are many different options: demographics, socioeconomic, housing characteristics, and this is just one of the buttons here. This is customers, information on customers. We go to percent 65 and over. We want our map to show that. We click on select variable, and the map is rendering. And we will see the zip codes that have the highest percentages of 65 and over. You've got options over here on the side. You wanted to add any reference layers, download the map, change the base map, or change the transparency. So I want to make sure I pointed those out. Okay, so we've got 65 and over, but what we also want to know is where are low-income seniors? Where are concentrations of low-income seniors? So we want to know the zip codes that have a median income of $30,000 or less. And we can apply a filter. So go up here and go apply a filter, add new filter. Now we want a socioeconomic characteristic. Select median household income, and then click on select variable. And there's a couple of different ways we can do this. We can use the slider, or we can enter the values manually. So the minimum is the $14,000, so that's the lowest household income. You don't want to change that. $30,000, and apply filter. Okay, so the map repaints to show only those households, or rather only those zip codes that meet the filter. So the zip codes that were not repainted do not meet that median income threshold in that lowest category. And remember, we're still looking at percent 65 and over. Let's scroll down here. I'm going to click on this zip code, 38109, because it is in the darkest blue. And it's got 18%, 65 years and over, and it does meet that threshold. So this may be an area we want to check out. We could also view information on these zip codes as well to see which one would really best sort of meet our needs in terms of the best options for expansion. One of the best things about Census Business Builder is the ability to create these reports. You click on Create a Report, and in the report, it will show us all of the information that's contained. We weren't able to go through all the filters. We certainly didn't have time for that, but information on businesses, consumer expenditures, all of that will be in our report. So first it tells us okay, so this provides information about the contents. This is my potential customers, and you'll see up top, this is the local business profile for home health care and zip code 38109. So we get data like population, percent under 5. You get some here, geographic comparison, which is great, to the United States, which is a 6.2, a little bit higher. You could use any of the characteristics to show up on the chart. We've got socioeconomic characteristics here, median household income, again under 30, which is much lower than the national average. Information on some housing characteristics as well. This gives you a good overview. Business summary. This is the home health care business summary, the number of employer establishments and how that's changed over time. See it decrease over time. Some are not available at the zip code level, like this business revenue or non-employer businesses, as well as the U.S. trade workforce or building permits. But you do get consumer expenditure spending data. So we can see how much people spend on healthcare in a given year, and then more specifically on medical services, non-prescription drugs. So you do get a little bit of that consumer expenditure, how much people are spending by zip code within Census Business Builder's report. You can download the data or download the report. You configure the content if, say, you want to take out those ones that did not display data, such as the non-employer statistics. We could just take that out. And it would no longer show at the bottom. Because you see over here on the content, it's no longer showing. All right, that is a very quick overview of the Census Business Builder and how you would use it to obtain information on maybe your best next step as a business owner, or just anyone who's working with needs-based services, such as a nonprofit or local government. All right. So I'm back in the Business Builder. I'm going to click on the Census Bureau logo to take me back to the main page. And at this point, the last thing that I want to show you is the National Health Interview Survey information that's on the CDC's National Center for Health Statistics website. So I'm going to go to cdc.gov. And I am not an expert on any of this information, but I do want to point it out so you know where to go if you're looking for it. And then the best way I got to it was going by A to Z index. Go to N. And this information that we're looking for is from the National Health Interview Survey. So I'm going to click on National Health Interview Survey. And survey reports and data. And then data briefs. Okay. And one thing I found very interesting was this, the use of yoga, meditation, and chiropractors among adults age 18 and over. I'm going to click on that. And here we see in this report that adults 18 and over, how they have used, or if they have used yoga, meditation, and chiropractic care in 2012 in blue, in 2017 in green. We do see an increase in yoga at 14.3% compared to 9.5%. Meditation, 14.2% compared to 4%. So close to 10% jump in the use of meditation from 2012 to 2017. Adults 18 and over, and we do also see a jump in chiropractic, but not nearly as high as the other two. And there's a lot of different types of data briefs that you can look at, but this was one that I personally found interesting. We also saw the information on prescription drug use, 30 and over, and that's also contained here within the data brief. So you just sort of have to scroll down and see what's available. But there's quite a bit of information collected by the Census Bureau for the National Center for Health Statistics on these topics. So there's not a lot of data like this on the website. It's just sort of, it's very specific, and it's a different way to look at healthcare data or health data from the Census Bureau. There's also some information on fast food consumption and doctor's visits. So just a spot for you all to explore. Okay, and our time is up, and that's all I have for you today. I appreciate, one more thing, not so fast. I'm going to go back, share content. One more thing I wanted to talk to you about. It's not sharing this, and I'm going to share. My PowerPoint, thanks for hanging in there. Census Academy. Census Academy is probably how you found out about this webinar, and some of the other webinars that are occurring. We have quite a few from both my colleagues in the data dissemination area, but also in some other areas, including the economic area of the Census Bureau. So there's quite a variety of information. And if you're interested in learning about additional opportunities, you'll go to census.gov/academy and really bring the data experts to you. There's also an option here to request free data training for your organization. That is something we provide. And if you haven't already subscribed to census.gov/academy, you can receive information on upcoming webinars, data gems, as well as get access to data courses. You can learn at your own pace, and that's something they're working on now. The resources and tools, all of the tools that we use today and all of the resources are here listed on this slide. If you have questions or need more assistance, please do not hesitate to call our Ask Data line at 1-844-ASK-DATA or census.askdata@census.gov. And I have included an evaluation and link in the chat, so if you have time, I would like you to fill that out and let us know how we're doing. Now I will release you when you've filled out your evaluation, and I appreciate your attendance, and I look forward to seeing you on another webinar. Thanks so much, and have a great day.